Oral Surgeon Report, by Dr. Joseph Mascaro, DMD. There is no good explanation, except two different individuals. Sister Lucy Truth commissioned Dr. Joseph Mascaro, DMD, a well-respected oral surgeon with over 40 years of experience, to analyze our full photo and video collections of the two Sister Lucys, and provide us with his expert opinion. Dr. Mascaro points out that not only are the profiles of the two individuals in nearly opposite condition, but these differences cannot be explained through dental work, and are caused by different skeletal structures of the face. Because of this medical fact, Dr. Mascaro concludes, "It is my opinion that Lucy 1 and Lucy 2 are not, and cannot be the same individual." These opinions are offered to a reasonable degree of medical certainty. From Dr. Mascaro's Oral Surgeon Report. After reviewing the photographic and video evidence over the course of several months, it is clear that Lucy 1, subject AB, and Lucy 2, subject CD, are not the same individual. Several anatomical facts support this conclusion, particularly when the profiles are compared. Retrognathic versus prognathic profiles. Lucy 1's mouth, teeth, tend to extend anteriorly, forward. In other words, her mouth area sticks out relative to her other facial structures. This is an underlying feature of Lucy 1's skeletal structure. This skeletal structure would not significantly change if all of her teeth were extracted and dentures worn. In contrast, Lucy 2's profile presents a nearly opposite condition, a prognathic profile with a concave appearance. Lucy 2's presents maxilla, upper jaw, protrusion, and mandibular protrusion. This protrusion is observable as Lucy 2's mandible, chin, is nearly parallel to the tip of her nose, a spot anterior to her nostril. Yet, Lucy 1's chin is recessed relative to the tip of her nose. The most anterior part of Lucy 1's chin is vertically aligned to a spot posterior to her nostril. Tooth extraction and dentures. Skeletal structure would not significantly change if all of her teeth were extracted and dentures worn. Dentures, which seem to be at least reasonably well fit, further support the conclusion that these images depict two different people. The presence of dentures would work to maintain the vertical dimension and prevent over-rotation of the mandible. With the vertical height maintained, there is no good explanation regarding Lucy 2's significant chin protrusion forward, when compared to Lucy 1. In addition, Lucy 2's facial height does not appear radically different than Lucy 1, which, again, supports the opinion that removal of all the teeth is unable to account for the marked change in profiles, particularly the mandibular protrusion. A skeletal, not dental, difference. A severely prognathic chin is skeletal, not dental in origin. Conclusion? During the course of my career, I have performed hundreds of jaw osteotomies, precisely planned fractures of the jaw to reposition the bones, and extracted thousands of teeth. I am familiar with expected changes to an individual's face as a result of tooth extraction and placement of dentures. It is my opinion that Lucy 1 and Lucy 2 are not, and cannot be the same individual. These opinions are offered to a reasonable degree of medical certainty.